So my practice, I work a lot with young athletes and young adults, and what I often find is that many are experiencing this attention deficit hyperactivity disorder. And, I really don't like calling it a disorder, but essentially that's what we have named and branded this. But really, I find that it's a gift. It's this neurodiverse aspect that individuals have, which is a positive thing. And so with that, though, we know that with this neurodiversity, there are some challenges, and particularly when we start to experience more stress in our lives and sports injuries, concussions, those types of things can really exacerbate some of these symptoms to where they become less manageable. So what I've been doing is really monitoring a lot of these individuals, functioning and basically when it comes to school and getting their other tasks done that they need to function and essentially develop in society. So about myself, I hold a degree in exercise science, master's of social work, doctorate of integrative medicine, and multiple other certifications that have allowed for me to utilize multiple integrative medical modalities that complement our mental health and well-being. Disclosure, it's my own business. All these things that I utilize are from trainings, and I'm not affiliated per se with any company and endorsing any products per se. So attention deficit hyperactivity disorder, and they took out the ADD out of the DSM when they rewrote it to the DSM-5, and I still kind of see it as just the ADD because not every individual has the hyperactivity aspect. But again, framing it the way that we're kind of at anymore with that it is framed just as ADHD, but Center for Disease Control still kind of acknowledges that not everyone has that hyperactivity traits, regardless if the DSM is not within an agreement of that. And I do find that there are, individuals with the hyperactivity aspect and individuals without the hyperactivity aspect. So with that said, it really affects about 9% of children in the US. And I believe that there are actually even more individuals that probably suffer from some of these tendencies. And really we'll get into a little more of why I hypothesize that. Beyond it's just, I believe that individuals are really capable of being very extraordinary performers and having a high level of standards or perfectionism that they hold to themselves. So I don't know if it's one of those where we're just like, oh, this is terrible, and there's this only amount of people inflicted with this, but really more that our systems are kind of set up to ostracize or make an individual feel that they are lesser than if their mind kind of works differently. And so that's kind of how I see the ADHD and ADD, is that these are really gifted individuals that sometimes feel that that whole perfectionist component of them, that they aren't good enough, and so therefore they kind of pull back and don't share with the world some of their more creative, out of the box kinds of levels of viewing things and thinking and problem solving. And so it's very unfortunate. But we look at young children, you can see here 2 to 5 years, 2.4%. And really when you're diagnosing at that age, it's just the little kids that cannot take any direction, and are super, tend to be hyperactive or very forgetful, those types of characteristics when that age of a child is diagnosed. And then going into the school age children, it's about, leaving the assignment in the backpack that they did get done, but they didn't turn in. And then there's the other pieces of not really paying attention when the teacher's talking to them or the coach and not doing the instructions that they're being directly told to do. And then we start to really get the 6 to 11-year-olds. I start to see that perfectionist tendency start to really inhibit them sometimes. And then going into the adolescence, this is where I really start to see that forgetfulness, insomnia kind of stuff, having a really hard time falling asleep because the mind is really active, having a hard time getting going in the morning. So that's really where I start to see more characteristics, of course, and then layer on, like I said, stress, adverse childhood experiences, parents who have some of these gifted tendencies, and the symptoms become more exacerbated. So that's where I'm seeing it a lot, but I certainly know that, we all have tendencies of attention deficit hyperactive disorder, but I think that it really starts to, when we're in the adolescent ages and on into adulthood, it's like how much the individual is procrastinating and then shaming and blaming themselves and having such varied energy levels and not really following through, even though they have a lot of skills put in place and in patterns. And so you really start to see these people struggle. Not to mention, of course, the neurotransmitter aspect of things that we'll get a little more into, but I find that to be the most scary one, because if we have a deficit in a neurotransmitter, that can impact our immune system and other areas of our brain. So it's not just that, going without medication is the best thing sometimes. So when we look at the types, like I said, it was just the ADD and the ADHD prior, and then they went ahead and just clustered them into one when it came to the DSM-5, which I didn't think was a disservice, actually, because then individuals who were the inattentive type or even the over-focused, we have some other measures. Dr. Daniel Amen has broken it down to having 7 types of ADD, but the most prevalent would just be the inattentive and the hyperactive or impulsive type. And I've even seen individuals that aren't necessarily overly hyperactive, but this impulsivity is enough to cause them to have negative consequences if it is not managed, or in even really the mindful awareness and maintenance. Yeah. So the inattentive, just some of the stuff I kind of talked about didn't follow through. It doesn't seem like they're listening when they're being spoken to. Really, when it comes to sustaining attention during play and tasks, that's really something that I see very often, is that an individual will be like, oh, I need to be doing these things, or I need to clean the house, or I need to, put up clean my room, whatever that looks like, but just they'll start and then don't finish, and that can get them into problems at home. And then, of course, when it comes to work and school, we start to see a decrease in performance. And then, of course, any necessary things and things an individual doesn't want to do, that's going to be the worst of the worst, is that if there's zero interest or passion or emotion around something, they don't really want to do it. The hyperactive or impulsive type. So certainly when we get into the adolescence, it's, talking out in class, talking out in front of their coach, not waiting their turns, blurts out answers in high school or in college or on the sports team, and cuts the coach off and they're the teacher. And so, of course, those things start to get them into trouble. And then the other really interesting one, and I see this very often with young men, is that, always on the go, kind of being driven by a motor. And then the impulsiveness starts to kind of turn into like risky behavior. So that may be aspects of, driving a car too fast, doing other kinds of high risk behaviors that can end very terribly. And even just almost silly things when we talk about like snowboarders or skateboarders and doing certain tricks without helmets, or thinking that that they can land a certain thing that maybe they couldn't. And then the combined type is of course both, but the real causes of ADD. And so this is what I think is fascinating. And, you'll get a lot of controversy around like doctors and prescribers and all these things saying how like, oh, it's, just giving kids speed's not okay. Just because the kid's hyper, it just means they need to exercise more or get out more. And really, those are not, the things that I see, because I'm really working with young athletes and young adults and other high performing adults. And it's really that they've done every single thing that they possibly can, but it has now become in a genetic, predeterminant here, right? So there's this, you can look at an individual's genes and really looking at their SNPs. And so that's one of my primary things when I first start working with an individual, is to look at their SNPs and see if they have deficits in dopamine and norepinephrine, right? Because the science is there, so we can actually look at these things and know. And 9 times out of 10, it's exactly that they have certain genes that would indicate that they have attention deficit hyperactivity disorder. And again, just saying it's terrible, and I guess I can just reframe it how I like to call it, that they are, neurodiverse and very gifted and in a different way. And so especially with athletes, you start to see that this deficit in dopamine, they really thrive when it comes to being under pressure and playing and training and taking the risks in sports and having primarily, in your extreme sports, because those are all dopamine increasing activities. So I truly believe in the genetic piece. And I see it often, that one of the parents is very gifted, and so the child is gifted, or both the parents are gifted. Here in the greater Seattle area where I'm from, we have a lot of individuals that are neurodiverse and gifted, and that's where some of these amazing advancements have come from. So really, again, reminding these kids of these things, because sometimes when they're in the systems and school systems and, sports systems, whatever that looks like, they are, told that they are bad because they don't fit the primary mold of, listening, following directions, doing the activities as instructed, when perhaps they do have a different way or a better way of problem solving and doing a task. And so that could be very harmful, of course, to confidence and all of that. And then when we start to look at certain environmental factors, so when we look at, the lead exposure particularly, this is another aspect of integrative medicine that we really look at. And, with the periodic table of elements with particular minerals, our body, if we do not have enough iron, our environment's very full of lead. So we will take in lead. Our body doesn't really discern between the lead and the iron, ironically. So that's another piece that I would like people to kind of look at too, because whether it is genetic or not, in that sense, the getting rid of these toxic metals and remineralizing the system can be very beneficial. So those are, things that I'm kind of looking at when you're looking at the genetic testing. You're also looking at the SNPs to see how well the individual can detox and methylate. And that also contributes then to that getting rid of the lead. And if, they have low levels of iron, or like, oh, it's kind of an indicator, let's add in some iron and do some things to help chelate heavy metals, which would be like the saunas, which are very easy and accessible for individuals who do saunas. And actually heat stress is pretty good for the body. So just looking at some of those factors, certainly not at a very, very young age, but when we're looking into teens, they've certainly been exposed at that point in time to other toxins and metals and so on. So good idea, because we do know that there's a decrease in the frontal lobe with lead, and individuals, let's face it, there's a lot of lead in our environment, not being able to focus very well. And then when it comes to the problems with the central nervous system during development, so that's your adverse childhood experiences. And so sometimes you'll even hear therapists and researchers around trauma say that, oh, it's ADD, ADHD is all from, adverse childhood experiences. You reprocess and process the trauma, and then the individual will no longer have these symptoms. And I don't believe that that's completely the case, because like I said, I've seen this genetic components. I've seen individuals do it all. And certainly with one of my modalities, it is a trauma reprocessing technique, but there are so many gifts with this neurodiverse, nervous system makeup that I don't really know if that's completely the case. However, much like the lead, much like the genetic piece of getting, dopamine, medication, it plays a role, so we can reprocess those adverse childhood experiences and some of those negative things that occurred in that individual's life. And it allows for them to not have as severe symptoms and be able to function at a higher level. And really, that's that whole optimization of peak performance. And so symptoms, I mean, there are so many. And I think that myself and, my father was very neurodiverse. And again, looked at my genetics, I'm aware of these things. It's been part of my life, my whole life, and managing these symptoms and doing all the health, measures to do so. And I guess that's one of the reasons, beyond being an athlete and then also having the attention deficit myself, it's really, I know these by heart, right? These symptoms, but it's just to the severity that it is keeping you from reaching your goals. It is keeping you from pursuing your wants and desires, right? So, yeah, the impulsiveness, the disorganization, problems prioritizing, the time management skills, the focusing on the task, poor planning. You can certainly read these symptoms here, but when it looks like, the mood swings and the emotional dysregulation and the time, time flying and all of those pieces, I don't think that people really realize sometimes how difficult some of these things are, because, as an individual who's had this their entire life, it's like, I can sit here and kind of stare and zone for a couple hours and not really do anything and kind of be okay with that. And, somebody like, well, isn't that just resting? This is like, it's a little different. You're almost like in a time warp. You just don't really notice anything that's really going on around you. And really, so if you're not doing some of the things that, here we go, some of the skills and making your to-do lists and keeping on task and setting timers and scheduling things, and you just won't do anything basically. you and that's when, poor performance at work and school, and the unemployment piece, financial problems if you're not working, and then when it comes to troubles with the law and alcohol or substance use and misuse, this is really going to be what I see the most, right? So an athlete, particularly if they've had an injury and concussion or any of those pieces there, that's when the substance use really can become, this habitual resourcing crutch to mask some of the symptoms. We know that alcohol increases dopamine. We know that marijuana does as well. So super common to see these young adults and athletes utilizing substances. And then, like I kind of mentioned before, with the car accidents and other accidents. And so I see that really often as well. And even up to doing risky things like going across a crosswalk and thinking a car sees you and getting hit by a car. I mean, I've had clients that have done all sorts of things where retrospectively, when they look back at it, they think, yeah, I was being a little high risk at that time. And, when we look at some of these complications, when things are not going well, or the individuals feeling that they are like failing or some of these things, this is when this stuff starts to come forward, as where I see more prevalence, like I said, when you have to take time off the team because you're injured or your grades aren't well, so you can't play or practice or whatever that looks like. That's when I start to see more of the complications, right? It doesn't have to be, unfortunately, but this is why it's so important important to have this, integrative multi approach model to really help individuals not end up in this space, right? So the suicide attempts, that's super common with the peak performance perfectionism. And I think that it's hard sometimes to tease out even the perfectionism is a big, philosophy around sports and knowing these high performers. But when we already have some of the neurodiverse aspects, that can really be that all or nothing thinking that leads to suicide attempts. And we know, that suicide is the third leading cause of death in athletes. And a lot of people, are kind of surprised by that because, yeah, seemingly athletes have it all. And they're so, we see them on TV or even just around our campuses, and we think, oh, well, everything goes so well in their life. And it's like, well, it's really that emotion, regulation and that all good or all bad. And so it's really exacerbated for athletes who are struggling with some of the ADD symptoms concurrently with that peak performance mentality. So when we talk about the trauma and stress exacerbates the symptoms. So this is where obviously, being a clinician, this is where I see the kids. Okay. So we've got either multiple concussions, they've been pulled out of school, they've been pulled out of their sport, they're still suffering with post-concussion syndrome. Then we have all the pressures of the academics, families, friends, trying to get into colleges, trying to finish college, whatever that looks like. And I really find that this is when I'm seeing these symptoms are just very profound. And it's almost like the work just is piled up so high, and no pleasurable things going on too, right? So if they're pulled out from their sport, it is very, very, very difficult to find the motivation to follow through, get the homework done that's piled up over a week that they've been out of school because of the concussion. And then on top of that, having some of the post-concussion syndrome symptoms are super similar to the ADD, ADHD symptoms. And, they, of course, they talk about like, oh, the potential of having ADD, ADHD could be increased if an individual had a head injury when they were very young. So again, there's so much crossover, right? I don't know many athletes who haven't had a concussion. I mean, it's really depending on the sport, but was that the cause? Well, we look at their genetics, it's like not necessarily. The genes are saying yes, that they have a deficit in dopamine or norepinephrine, so we can't completely blame it on that first concussion, but we certainly know that first concussion could have exacerbated these symptoms. And so then we have to do more to decrease the level of the symptoms and how much they are impacting your life. So the work that I do, I'm very attached to Dr. Stephen Porges's Polybagel Theory. So the two ends of the nervous system, the parasympathetic and the sympathetic. And when we talk about that, our parasympathetic is the rest and relaxation, the recovery, the kind of theta brainwave states. And then when we look at the sympathetic nervous system, that's our fight, flight, freeze aspect. So basically when the pressure's on, we are triggering our amygdala to produce cortisol and stimulate our glandular system and be in this sympathetic nervous system state. So that's the heart racing, the feeling like we can't breathe, or the hyperventilation, the gut kind of turning, all those pieces when these young kids are needing to perform in sports or perform in life, like school or band, whatever the kiddos are involved in. And so what really begins to happen is that if we already have some, symptoms that associated with emotional regulation, right? So really high highs and low lows, then we're going to naturally ramp up this nervous system to kind of be in the sympathetic state for prolonged times. And so that's what I'll really start to see is that, these high performers, they've played soccer since they're 5 years old, and they're kind of living in that fight, flight, freeze state at this point in time. And it's really exacerbating the pre-existing ADD, ADHD symptoms. And so that's not good and we can help them. And so then we look at our vagus nerve. And so within that nervous system, our 12th cranial nerve is called the vagus nerve, and or vagal tone. I mean, it's referred to by various labels there. But when it comes to conditioning our vagal nerve and our vagus, or our vagal tone and our vagus nerve, we know that we are conditioning ourselves to be in the parasympathetic more often. So I really like giving the kids these, of course, mental conditioning techniques to stimulate the parasympathetic nervous system to get them out of being dominant in the sympathetic nervous system. And so another big component of this, though, is that the gut-brain axis, right? So if our neurotransmitters are produced in our gut and we want to strengthen our microbiome, it's paramount that we calm down the sympathetic and engage this parasympathetic and strengthen this vagus nerve. And it's just like we were talking about earlier with the not having enough dopamine. Well, gosh, if our vagus nerve is weak and we are not getting these neurotransmitters up to our brain, then of course, again, another level of exacerbation here. So I think this is really important. And then another piece with this that we found is Dr. David Musnick. He's a triple board certified doctor out here that works a lot with concussions, and he's a sports med doc. And he talks about really when we have, a concussion and then looking at Dr. Robert Scar's work, the MD neurologist said, hey, we don't really know between the two and how to discern between mental or physical stress or trauma. Therefore, we hold on to it the same way. We know that we're breaking down the communication to the gut muscles when we've had this trauma to the brain, or like I said, it can be that high level of stress and all these things as well. So again, just things to look at here, and to not necessarily blame it all on the individual, because I guess that's kind of where we're at with destigmatizing some of the mental health stuff and being able to assist people instead of just being like, oh yeah, well, you're struggling with these things, but you just need to be tough and work through it or become more resilient, or whatever some of the toxic languaging is within our sports community, and even just kind of raising our children at this point in time. So instead, it's like, hey, there could be some things off here. We need to focus on being more parasympathetic dominant, strengthening this vagal tone, and knowing that that's only going to cause a positive result. And then the microbiome's almost like a whole nother topic when it comes to, taking the probiotics and doing all those pieces after, your athlete does go through like a head injury or high level of stress or something like that. And so, I like this. I know that, Stephen Porges has his own chart, but this is very simplified for what I do and what I understand and try to get my athletes to understand. And that's when they have these injuries, and it doesn't necessarily have to be an injury per se even, but it can just be a really traumatic event happen. Say the family dog dies, or a breakup happens, or a kid does very, very terrible on a midterm. And so that can be our little injury arrows as well, but we just start to stay in the sympathetic nervous system state. And I really see that, the kids aren't sleeping. They keep getting injured. They're tired all the time. They start to get yips and blocks, and what that really just looks like is they try to execute the skill and they can't. So then, you start to hear the languaging around all those things too. It's like, I think I want to quit. I feel like I can't perform. My, body feels like it's in cement. Starting to get into these interpersonal relational conflicts that we talked about earlier that are prevalent with individuals with ADHD and ADD. So these things are all, again, if we already have some of this pre-existing in our nervous system, certainly one of these negative things that can cause any athlete to start to get into some of these spaces, it can occur quicker and it can be more dramatic, right? So with that lack of emotional regulation. So really my work is to try to get someone out of the sympathetic nervous state all the time, and really within the first time of talking to an athlete, I'm asking them how much they're sleeping, because that's a huge indicator to me if they're in the parasympathetic and able to recover. So really being mindful of that with your athlete at home and your clients or whatever, that they need to be sleeping, and that's going to be our first indicator. Let alone so much of the exacerbation of not getting their homework done, not being able to focus, the emotional regulation piece, using drugs and or alcohol, all those. And yeah, so the stuck and sympathetic. And so this is kind of what I was talking about. And these are the really negative long-term outcomes too, when it comes to the hyperthyroidism, the hormonal imbalances, and then the hyperthyroidism can come down to this crash. And put the crash in there. There's a lot of individuals that believe that, frozen can be like a crash, where people get this adrenal fatigue. And I see it really often with young athletes, and people would not suspect, there's like, wow, already, they had this high level of cortisol. Now they don't have enough. Their cortisol levels are not appropriate for what time of the day it is. So I do really see that. And in that crash is where I'll start to see even like chronic fatigue and other chronic co-infections, which also, our immune system needs dopamine. So, I know that there, again, is a lot of judgment and opinions out there about medicating individuals with ADD with stimulants. They're like, oh yeah, speed, this. It's like, yeah, but if the individual is not getting enough dopamine, we know from Dr. Daniel Amen's work that, again, these cause these negative side effects of, not having a strong enough immune system and the brain just not getting the chemicals that it needs. So it's kind of interesting when you hear a lot of the anti-drug, because yes, I understand that there are a lot of individuals struggling with addiction, individuals dying from the opioid crisis and some of those pieces. But I believe that if someone's properly medicated, then it's going to decrease the potential for the drug and alcohol, illicit street drug overuse of and abuse of medications. So again, all of these things, and I guess I didn't talk about as much the anger. So that's going to be, some of that emotional regulation. And then of course, just what's going to begin to happen when you're living in the sympathetic state all the time. And yeah, the muscle guarding piece, the performance anxiety. And it's really interesting when I'm working with athletes, and even their parents will call me and they're just like, oh, they have performance anxiety. It's like, well, what is performance anxiety? It's like they start getting into it, and it's like, oh, their hands are shaking, their heart's racing, they do well in practice, but then when it's time to perform, they're not doing well, and they're losing, they're dropping balls or things that they shouldn't, making these mistakes that they shouldn't. Well, we looked back at, the ADHD. It's like, yeah, well, that's obviously a normal tendency. And then when we start to get some of this trauma in here and too much pressure, exacerbated again to where this individual is not, in an optimal performance state. And so, Dr. David Grand, he created brain spotting, which I'll talk about in a moment, about the therapeutic modalities that I utilize. And really he hypothesized, and you do see it. I see it pretty much every day when I'm talking to athletes and, trying to learn more about what the symptoms are, what's going on, is that we have a trauma memory network or stress memory network. I mean, we talk about the word stress, I think, more often in our society, which trauma, stress, injury, upsets, whatever you want to call it, failure, we really react the same way. We know that they actually just published a study talking about the motor neuron area, motor neurons and the motor movement area in our brain getting weaker and deteriorating based off of chronic stress, right? And you're like, wow. And that the chronic stress is the same with compared to with concussions. That's the microglial becomes hyperactive and starts to kind of attack our own brain. I'm like, wow, yeah. So stress, trauma, all fairly interchangeable to me when it comes to how our body's reacting to things and the negative outcome. But with that, we have, okay, the dog died, best friend moves away, breakup, conflict with a coach, and then a sports injury. So we get like 5 traumas here. Then the target trauma when it comes to, oh my gosh, I failed my test, or even the target trauma or target stressor pressure could be playing in, the state competition. So when that target one occurs, we go back through all these other traumas because our body's reacting in a survival mechanism, not wanting a negative outcome to come again, because I guess for some reason we think that we can constantly guard ourselves and keep ourselves from having to experience a negative experience again based off of kind of reliving it and in, trying to protect and be hyper vigilant to that experience. So I find it to be an interesting concept. And I find then that, of course, when that target pressure comes up after we've worked through these past traumas and really reprocessed them, we don't have as strong a reaction. We don't have as strong as symptoms of anxiety. We don't have as performance anxiety. We don't have that hyper arousal in the body. And that's the other piece too with this is this can be very unconscious, right? So the body arousal compared to the cognitive consciously, identified anxiety. So, and that's a really common thing in sports psychology. We talk about body arousal and cognitive anxiety. And so, that body arousal can be very unconscious, that just even showing up at the competition can get the body to react in this hypervigilant protective state, really associating all these past pressured negative experiences. And this can even just be every time that they felt like they didn't do good within their competition. So that gets me into my preferred treatment modalities, right? So with the work that I do, I always start off with the brain spotting with the binaural frequencies, and then moving into the others. Basically, I like the others, but sometimes when I'm doing the tele, I can, or the Zoom sessions with athletes all over the world, in fact, that we don't always get to do the other 2 modalities. And so I see big shifts even with just the first psychotherapeutic and frequency medicine. And then I see amazing results on through, but I can certainly give my clients other shifts or techniques that do very similar things to the second and third treatment modalities. So brain spotting. So Dr. David Grand created brain spotting, and he was a social worker, licensed social worker like myself. So doing that clinical piece under the social work license and really understanding that, he'd been trained in EMDR, so the eye movement desensitization reprocessing. We know when we move the eyes, that's where with the second cranial nerve is triggering the brain, and then also able to access that brain stem. So, we know that that's a very, effective technique for reprocessing trauma out of the body. And then he was also trained in hypnotherapy, which using that kind of bilateral sound, the metronome kind of sound to get you into kind of that unconscious state of mind where you can access unconscious information, access memories that had been kind of either disconnected, disassociated from the mind because out of survival, or even just slight body experience, like when an athlete has an injury or catches a ski when they're in a competition and the body reacts outside of their conscious control. So he knew that with the bilateral sound, manipulating the visual path, and then also he started looking at the focused mindfulness aspect of things. So as opposed to just being like, yeah, well, it happened and I recovered, and that kind of resilient strengths-based mindset, as opposed, he would go in and you sit here and you want to see what information is attached to an injury or information is attached to a worry or that felt sense of the anxiety, and to fully process these things. So reprocessing, reprocess, desensitize, all of that piece. And then of course the somatic experience piece. So he talked about, Peter Levine's work of accessing the body where we're feeling this, consciously identified performance anxiety about playing the sport. Where are you feeling that in your body? And then therefore finding an eye position or reflexive cue while listening to the bilateral sound, which is dropping you into that unconscious altered state, and then finding an access point of a reflexive cue to be able to fully process these past experiences. And he started really just combining and doing his clinical case studies on that, and then started sharing with his colleagues, and then started to develop what he calls brain spotting. And it's been around about 15 years or so, and it's really catching on with a lot of the therapists, and I find it very effective and have been using it for about 10 years now, and had the privilege and opportunity of having it done on me back when I was just retiring from my sports and lots of sports concussions and dealing with a lot of my high levels of symptoms at 23, so 15 years ago. And I really felt instantly a shift with the arousal in my body and with the cognitive anxiety, or essentially the symptoms when it comes to the all or nothing thinking, the impulsivity, the inability to calm down, sleep, all of those pieces. So I found it so impactful that kind of ditched the exercise science track and went on and did my graduate studies in clinical social work to be able to work with athletes like myself back in the ski town where I was from, and really helping them work through these things. And so this was a US ski teamer client nearly 9 years ago now. And this is what it looks like. We're really talking about the potential of injury, I believe, given in this session this many years ago. And so following a pointer, and if you're doing it over tele, they can certainly use a pen, or you can even use the screen to find, and you're really looking for that reflexive cue. It's going to be kind of a strange wobble with the eyes. It's quite fascinating. Really, in the end, when you have been doing it for so many years, you'll see that the body has these like visceral arousal reactions when you're talking about the cognitively activating thing. And when you access where you're feeling it, it's kind of an instant connection of finding that eye position. So that's really brain spotting. And really what the process of brain spotting looks like in any of the work that I do is we go back through and get a detailed kind of trauma history, current stressors, and I will also do Dr. Daniel Amen's ADD, anxiety, depression, and then I'll do the Hamilton anxiety. So I do quite a bit of upfront, and I will do the cognitive domains and I'll do the King-Devics. So I have a lot of pre-testing when it comes to and cognitive domains, King-Devics, that's concussion. I do the Hamilton anxiety scale because I find that with my process in general, even if the individual's not suffering from, as determined through the Amen questionnaires on ADD or anxiety or depression, even if they're not struggling with any of those, that I will still see a shift in the Hamilton anxiety scales when I'm done working with an athlete. But when it comes to the ADD, beyond creating those, stress, trauma list, life history kind of stuff, and then of course just the regular measurements to see like, hey, are there certain areas of the brain and brain chemicals? We can go a deep step further and having someone do the 23andMe, spit assessment to see what the genetics look like. And then we, go from there into what we found. And this is how I will work with an individual with the brain spotting modality with ADHD very specifically then. We process the overwhelm of the tasks to improve time management and organizational skills. We identified the triggers and extinguished them to reduce the impulsive behavior. So, okay, so when you feel like you want to go to Taco Bell and buy a whole bunch of snacks when you're feeling stressed about school, let's go ahead and process those emotions. Why are we stressed about school? What is it that, and typically stuff comes out in the processing of like, well, I just don't feel good enough. I don't ever feel smart. I'm always told that I'm doing the wrong thing. And the fact that I have to get up and extinguish some energy and stuff in class, I get criticized and I've been shamed for that. And so any of those kinds of triggers that come into why an individual would then reach for a habitual resourcing behavior. And same could be like if, they want to smoke pot after school, it's like, or weed, whatever. It's talking about like, okay, well, what, what are the things that trigger you? Let's fully process those so that they don't trigger you to these impulsive kind of self-harming kinds of behaviors. And then again, the potential, of failing and the problem solving skills. And I think that this one's most important oftentimes with athletes of, hey, let's fully process the whole component of you could lose the game, and that would just be so upsetting, right? And so disappointing. So let's go ahead and reprocess that or process that, or even when it comes to after the game, it's like, okay, let's fully process the fact that you didn't win, and that hopeful that processing and having the athlete come and work through these things, as opposed to, like I said, turning to drugs and alcohol or something. And then reprocess like I said, the academic or work or social failures, huge, being called out, shamed, any of those pieces. And then the self-criticism, again, it's hard sometimes to tease out if it's the perfectionism that we have identified within sports psychology as being really prevalent in athletes compared to if it's the ADHD when it comes to that self-criticism, perfectionism, all or nothing thinking, to improve the self-esteem and the performance confidence, self-worth, all of those pieces. And then reprocessing and desensitize the past negative interactions with others. So that's can be also that, guarding aspect of things where, well, in the past, someone made fun of my high energy or me talking fast, or told me that I was annoying, or something like that. So being able to really process those past hurts and pains so that you will take a chance again, so that you will open up to people again. Because I see a lot of times that, that kind of trust piece gets lost, and particularly with like school systems and stuff. Once a teacher or someone has made a comment, some of these young adults really struggle with being able to trust that teacher, and then their performance naturally declines. And same thing with coaches, of course, because coaches are very much more attachment with a coach than a teacher in general. And then, yeah, the anger component. So when you're going through that kind of thing with the brain spotting, particularly with other teammates and stuff, right? So I'll have some athletes, it's like, okay, well, they'll be like the showboat on the team or something. So let's go ahead and process this individual further and all the things that bother you about them, so that you're not getting too hyperly focused on that other individual and getting angry and losing your ability to perform optimally, because again, that's going to be pushing you up into that fight, right? That sympathetic nervous system. So I find that brain spotting applied to ADHD is really effective. And again, so when we talk about with brain spotting, the amygdala becomes less reactive. We can kind of reset it. So, and you will see that, like I said, with that cortisol serum test, like we see this decrease in overall cortisol, or we see the better, arc of when we want cortisol to be high in our day, as opposed to it being low in certain times and high at night, or something that's not accurate. So, well, not helpful, not healthy, let's put it that way. And then also, we've seen that the energy in the hippocampus increases more. So I find that to be interesting, because then that's kind of our resourcing part of the brain, and kind of where we're playing our experiences like a movie. And so become our perceived memories become less negative, right? So when we're creating memory in the moment, taking in information, the information isn't always as negative experience, it's more positive. And then, of course, the Dr. Robert Scar talked about that our homeostasis can be reset, right? So, and that's what I say when I'm saying that we're trying to get someone to be more in that parasympathetic nervous system state instead of the sympathetic nervous system state. And the light therapy. So we talked about that. I really like the light therapy for lots of reasons when it comes to healing the brain and increasing mitochondria and helping with detox and all those pieces that we talked about with the heavy metals, and increasing blood flow, and especially helping the brain detox and bring the blood flow back after a head injury. But very specifically with photobiomodulation and ADD, and this is a client that was okay with me taking the photo. He's doing the audiovisual entrainment and the photobiomodulation light therapy that we can go ahead and turn on here too. That's what this thing is sitting next to me. It's a helmet that we put on the head. But it also increases dopamine. So that's important as well. So relieving the chronic pain, decreasing inflammation, increasing dopamine, and then can help with sleep. So those are all things that, like we've talked, an individual with ADD, or lots of individuals at this point in time in our society, I think, are just dealing with some of these components. I love this science, amazing. And then the audiovisual entrainment. And so, you know, the David Seaver, who created that device, which again is right here also, with the frequency medicine of this sounds and lights, stimulating, well, essentially entraining areas of our brain with the proper frequency to kind of rebalance it. He actually created a device that's specific to ADD. So very, very effective, very cool stuff here. And again, so in training the brain waves, you know, getting us out of that beta, which of course is kind of that sympathetic nervous system, and down into that theta. So in ways we can entrain the brain, and also humming, whistling, breath work, yoga. Those are the other ways that if I don't have physical access to be able to do the light therapy and the audiovisual entrainment, that's what I'll do, is have them do those shifts and those little tricks to constantly trying to get that parasympathetic nervous system to be more active than the sympathetic nervous system state. And the HPA axis, the thalamus functionality is restored also. We talked about the homeostasis, the amygdala, and then brings the blood flow back to the brain when it comes to the photobiomodulation. And in lieu of that, I will have people do high intensity interval training to help with detoxification and bringing back the blood flow to the brain. And of course, increasing dopamine. And just pre and post kind of scan here. You'll really see that here in the, where the arrow is where we should have the most brain activity. So after a session, we really see restored, healthy looking brain on a QEEG brain scan. We see the reaction time increases, we see the voltage in the brain goes up, and then we see that the beta theta ratio is decreased. So less up in the sympathetic and more in the middle of the theta beta, like we showed on that chart last of the brain states. We want to be kind of in that flow state. And then this is just regionally how the reaction time. So again, the reaction time's increasing. That's our P300. We want it to be closest to the 300 milliseconds or less to respond to a sound and clicking a mouse, or respond to seeing an arrow going one way or the other and responding if it's either right or left. So that's this WAVI QEEG that I use. Yep. Okay, it doesn't want to click. So right at the end here, right under the time frame here, you can reach out to me about any of this. I didn't talk about a lot of case studies. I certainly, if you're more interested in any of this and learning more as a provider or wanting it for your family or friends, reach out and I can direct you to, we have brain spotters all over the world, and certainly anyone can own either of these in-home medical devices that I utilize. So thanks for sitting through my presentation.
Thank you so much, Dr. Paige, for this knowledge-filled speech. Thank you.
Yeah, absolutely. And yeah, I hope I wasn't too slow this morning. So
No, that's fine. Dr. Paige, first of all, is this time right for you? Like in India, it's night time, but we tried our best to provide our speakers from outside India the time that they can easily attend. Is it the right time?
yeah, like I said, though, it's like I thought it was the night before, like the other ones. So I mean, it's just I guess knowing when for sure it was and figuring it out is all. So yeah, I'm good.
Okay.
Thank you so much.
Yeah, Dr. Paige, there are a few questions.
Oh,
You
okay.
don't
What's
mind?
questions? Am I?
Shall we? Yeah. Dr. Paige, firstly, I would like to ask that what's your sport? What is your
Oh,
favorite sport? You must be.
well,
In-
I was runner and skier and swimmer. And so
Oh,
now I'll just run and I like to work out. So I'm more of like your weight training and all that kind of stuff. But when it comes to watching, I like to watch skiing. I like freestyle moguls and the snowboard half pipe. So coming from a skiing background and a snow sport background, and those are the primary athletes um, that I enjoy working with, our Olympians and all that kind of stuff. So it's fun.
that's impressive. Dr. Page, one more thing. Since I'm not an expert, but we are having a few questions for you. That Are there any side effects of ADHD treatments?
Um, when it comes to, I think that there's more side effects of not treating medic, if an individual has a deficit in dopamine, I think that the brain gets sicker is kind of what we see if they're not on a medication or using some herbal supplement that can assist the body with the dopamine piece. When it comes to the brain spotting, audiovisual entrainments, and the light therapy, no negative side effects. No, it's only positive things. Utilizing your own brain body's ability to heal is what these are all about. And I like to go there first. Some people never actually have to, and of course, using herbs and the neurotransmitter, foundational neurotransmitter stuff, decreasing some sugar, so the inflammatory kind of piece. Some people can get by with that, and that's fine. But we know that things like Parkinson's come from not enough dopamine. So it gets a little scary. So I really do like to look at the genetics to see, because if this individual is truly suffering and doesn't have enough dopamine, we don't want someone to end up developing more severe neurocognitive disorder someday. So I think that's, yeah, more important than being concerned about, hey, if you take a little bit of a stimulant that makes the brain release the dopamine, then I find that down the road of an unhealthier brain over time is worse. And oftentimes you'll see individuals are already self-medicating. So if they're self-medicating with alcohol or marijuana, it's like, ooh, that's way worse than a little bit of a stimulant. So I find that if the person's on the proper medication to begin with and doing these other therapeutic modalities, it won't lead down some of those more destructive paths.
Definitely.
Yeah.
Definitely. Okay, one more question that Dr. Page, how do you help uh, patients with poor self-image problem
Ooh.
in general?
So as you know, okay. So one of the things that I have people do, so I like aspects of energy psychology too, right? Every cell in your body is listening to you. So when at
Mhm.
first we start working, I want people to walk around and kind of reparenting themselves or re-instructing and coaching themselves. And I want them to give themselves compliments all day. Like, oh, I got up on time. Good job. Oh, I got ready for work on time. Good job. Oh, I look nice today. Nice. Oh, I got to work on time. Oh, I parked the car well today. As silly as it all sounds, words have a lot of power. And so a lot of times in our developmental stages, we didn't get all of that. And so those are the things that really help someone build a good foundation of confidence. And then other pieces of just, when those negative thoughts come into mind, I have people create a mantra. And so every time a negative thought starts to come up, they start to shame or blame or traumatize their own brainstem or their own nervous system. I'll have them, have this go-to mantra. And it's like, oh, doing the best I can. That's always mine when it comes to, oh no, I feel like I was 2 minutes late for this. Or, oh, doing the best I can, doing the best I can, and not allowing for those shameful things, the shaming, blaming, because we're really good at being so self-critical. So giving ourselves compliments, having that mantra to counter. And that's a little bit of mindfulness too, like knowing when we're starting to be mean and hard on ourselves. But those are some of the first just ones anyone can do. And then also, it's like you can have access to the bilateral sounds, they're out there. And so getting into that deep brain, there's that kind of dumping where you can put on those and write out all the things that ruminate in your mind and the things that you don't like about yourself, and write them out and tear them up and throw them away, and they're no longer a part of you. So just some of those
Yeah,
practices to shift that energy, beyond, doing clinical work, to work on peak performance and confidence and all that. And,
that's true.
there's something overall too, just in general, to keep in mind is that, performance confidence comes in trusting in your training. So knowing that, hey, I've worked hard for this. I went to school, or I read this stuff, or I studied, or I know that I'm a good mom because my child is doing well. It's like trusting in your training. It's like, oh, I had a good mom. I'm a good mom. And just kind of looking at and reflecting on how much you've done to get to where you are.